So for everyone dialing in, um, this is an opportunity for everyone to meet our Director of Pathology at the VA Puget Sound Medical Center, Nadeem Zafar, talking about a very timely topic. So just a little bit of background for Nadeem. He's originally from Pakistan. He um, trained in part in University of London, came to the US and trained in pathology at mainly University of Texas, a bit also University of Tennessee, had fellowships in cytopathology and hematopathology, and then joined the faculty at University of Tennessee in Memphis in 2011, at where he was director of the residency training program. And as he was being recruited to the University of Washington, he became chairman of the Pathology Directors Council. So he's very familiar with residency programs, the challenges, the dynamics, and also concerns about recruiting individuals, people, medical students, and earlier stage individuals to go into pathology as a career. So the focus of his talk now, and what we hope it is going to be an active and interactive talk. Nadeem has requested that questions be held until the end of his talk, but the topic, as you see here, of course, concerns recruiting students, young people, to really consider pathology as a career. And when I say young people, as we discussed, I think it begins before certainly medical school, high school, maybe even younger than that. So, Nadeem, please take it away and tell us of your thoughts.
Okay, thank you, Larry. So I presume I can be heard clear and I can be seen okay through the camera?
Yep.
Okay.
Yep.
So the topic is, as Larry said, it's a timely topic, but unfortunately, it's been a timely topic for the last 5 years, and I'm going to go over the challenges that our community as pathologists have been facing. So the title is Waning Interest for Pathology as a Career for US Medical Students. In the second part of, there are three parts to that question. Have we reached a crisis point? And I'll let you guys decide about that. And the third thing is, can can the trend be reversed? So I don't have any conflict of interest in this presentation. And the reason for this presentation are essentially threefold. One of them is to generate a discussion at a local level, and I'm already heartened to hear Larry think that we can make something national, a quasi-national out of this concept of this thought or this concern that we have here in Seattle. What I also intend to achieve is brainstorming, and that's kind of what this reflects. And then finally, we have to come to a conclusion whether we should stay on the same track or we should be changing our track to a better track. If there is an issue, there is a challenge. The aim of this presentation is not to put everyone into despair or not to confuse the issue, but to clarify it, to take up the challenge and move forward from there. So again, the three questions are, is there waning interest for pathology as a career for US medical students? The second part, have we reached a crisis point? And the third part, can the trend be reversed? Let's go over the category of, residents, where they come from when they join our training programs in pathology. And these are the categories. So we have the US MD seniors from the medical school. These typically graduate after July 31st of the match year. Then we have graduates of US medical schools who graduate before July 31st of that year. And same thing for DO applicants. And then we have a pretty large number of international medical graduates, which are divided into two categories. Those who are US citizens go overseas to study and be doctors. And non-US citizen IMGs, which is a fairly large number. And if you see the categories there, the number one category is in pathology. The number two is our own seniors. And then number three are, again, IMGs who are US citizens. The difference between these two categories, once they've finish their residencies and fellowship training. Those who are US citizens do not need to have sponsored jobs, and they can join a position anywhere in the country. They don't need a sponsorship, unlike IMGs who do need sponsorships. And let's go over the match for the last 5 years, and this should give us some sense on where things stand for pathology. The number of this is so I will compare 2017 going towards 2021. The number of programs in 2017 were 159. They have now increased to 165. And the official positions on available have gone up from 601 to 611. The unfilled programs, they kind of, they tend to flicker, go here and there, but the number is around, the last year was 14 that went unfilled. This is important. In blue color, you see the number of the senior US MD seniors, the medical students. That number has dropped from 232 to 212, despite the number of programs and positions going up. Look at the total number of applicants. In 2017, there were 846 for the 601 position. Now they are 945. So there are almost 100 more applicants applying into pathology. If you look at the match for US MD seniors, their number has gone from 2016 to 198 actually. And this is very much in tandem with the number of applicants. And this is kind of interesting. When I saw this number, the 198 number this year, that took me, I got a little bit of a shock out here because I don't ever remember seeing us dipping below 200. But here we are. And the total match has gone up from 545 to 589. So we have matched more people as we increase the number of positions and all. And the percentage of US medical seniors matching into pathology has dipped from 36 to 32%. My concern is, and I hope I'm wrong, but next year it's going to be around 30%, somewhere between 30, 32%. And the total fill rate for pathology is around 96%. Now we've also started receiving numbers for DO seniors. And so we kind of, in 2020, there were 11% of total residents who were DOs. This year it was 9%, but I don't think that's significantly different. So where does pathology stack up against other categorical fields of medicine? And again, I think this picture should tell you or this photograph should tell you where we stand. And we are the lowest of any categorical fields of medicine. We took in 32% of our own people, were 32% in the total resident pool. And if you compare and this is not for transition, these are categorical positions. Categorical positions are 100 or more for any field. Compare us to radiology and look at what they got. They got 68% of new residents coming from US medical schools. So I think it's a timely comparison to compare us with radiology. I just brought up radiology and let's see where we stack up against them. Again, look at the trend. Their programs have also gone up in a similar way, not a whole lot, from 169 to 177. They offer almost 50% more positions than us. So their programs are per program typically bigger. They started from 932, they are now 986 for 2021. But look at the number of US seniors applying into radiology. It's almost 4 times that number. And it's remained 4 times that number, or actually become more than that. So if you look at these total number of positions that are available, and I'm not saying they should all take US medical seniors and all, that's not what they do, but they have a very healthy pool available to select. And I think that what they smartly do is they get the top from both US medical seniors as well as IMGs. And we will, if you look at the number of applicants, the number is 60, 70% more, started from 1497, went up to 1657. But look at the match for US seniors. Their number was almost 3 times, slightly more than us, basically. And probably that ratio is increasing in their favor, basically. So, 667 to 670. But they still have their pool is pretty healthy for US medical seniors who are applying into radiology. And the total match went from 917 to 979, so they have kept up with that. The US MD seniors, About the same percentage, 72 to 68%, and their total fill is almost 99%. So they have been getting, they have been able to get the best of both worlds, if I can use the term, basically, both US medical seniors as well as international medical graduates. So whichever way we look at it, our graph is coming down essentially. So we are struggling to recruit our own medical students. We can approach it many different ways, but this is a fact. So the answer for the first question is there waning interest for pathology as a career for US medical students? And the answer is absolutely yes. Let's look at the other 2 points. So if the answer is yes, the next question is, can we change the trend? And the answer is yes, we can change the trend. It's not going to be easy, but it is definitely worth it. So the first thing of, if you want to change anything, is first thing is to accept the fact that we need change. And we don't have to be that granular, but we should look at change management. We have to spread the message around pretty aggressively, smartly across the community, and then start becoming more granular, setting targets and going after those targets. That's critical. So the first thing is accepting change and then being more granular, better organized. And I will go over a lot of those things that need to change and why we need to be more granular in how we are living as pathologists in the US. So how did Pat land here in the first place? I think it's worth looking at the history of why we are here now in a very awkward position. What are the factors that make pathology unattractive to US medical students? And I need to bring this up. I'm an international medical graduate, but I know the importance of having our own students coming to pathology, both for the well-being of the current field and long-term payers, and how the deans will look at us. And also there are a lot of important factors that are dependent on how we are able to attract our own medical students. So if you talk to the medical students, a lot of them will say, well, we want to deal with patients. We are doctors after all. And these are all telling statements. All of these are telling statements, basically. What about exposure to pathology and visibility to pathologists? Well, most of them have no idea. And this is worrisome if the medical students don't know what we do, what we live in. Are we only dealing with dead bodies, for example? And that's a factor they know about. What about demand and supply of jobs? Who gets the desirable jobs? Not most of the jobs are not advertised. Is that good? What about the lifestyle? A lot of them think that it's for pathologists, it's difficult to plan, and I think they are not wrong when they think that we are living long hours and we have become more inflexible over times as we are working more to make the same living that we did in the past. What about our personalities? What kind of people come to pathology? They think these are recluses, socially challenged, weird, and people who don't want to mix. I don't think that helps. They also know that they believe in it, the fact that pathology does not pay well compared to other fields. And I will go over some of that with radiology. One of the major concerns, including talking to some of our residents, current residents, is they did think of, and they were told that digital pathology and AI will be very disruptive to pathology and will have a significant impact on our future careers. And finally, this is something that bugged me basically as an IMG, and I don't know what that means, so I'm not going to be talking much about it. But this is a comment I got from the Student Doctor Network. Pathology is for the IMGs. And I thought that was a very telling comment. I think when we are selling ourselves, and this is another area which has hurt us, and I'm going to go over that down the line in this presentation. We do deal with patients, but the students don't know about it, and at the same time they don't realize dealing with patients is not always easy, and so they are type of difficult patients, and the issues around dealing with patients, and we are not able to have that kind of a conversation with the medical students ever in the comfort of our settings, that or the perception they have about us is not necessarily correct, and they're challenged with dealing with patients also. And this is interesting. Again, look at this. look at the slide up top left. This came from the Royal College of Pathologists of UK, actually, for a YouTube presentation. It doesn't say who is a pathologist, it says what is a pathologist. And this is for high school students and other people, lay people. I mean, it's what, it's not who. And I thought this was, again, this was one of those things that kind of, challenged me. And I said, what's going on here? And then look at this. This is another from another site for recruitment. And this presents us, and this is one person's opinion again, as a group of nerdy people who are into kind of, enjoying solving mysteries and finding answers to the unknown. We do that. But are we not fun people? As I think somewhere along the line we have lost that feeling that we are great artists. Also, we love music, we love to eat. We have I can see Oliver out there. We will go miles and miles searching for food, travel the world for cuisine, cook, do a lot of good things besides our profession. And this reflects in this is a Medscape graph that I'm sharing with you. So how happy are pathologists outside of work? And look at where the red line is, where we stack up. Basically, we are almost at the bottom. I don't know where these numbers come from, but these are public numbers. These are available, and these are from professional sites. So as Larry asked me, where should it begin? And this is where it should begin. It should begin at least in high school, not later than high school, basically. And there's a strategy that I would highly, highly recommend, that we should work in sync with the technology field as well. Not just for pathologists, but working together with technologists, targeting STEM students for biomedical sciences, career, and with emphasis on pathology, both as MDs as well as technologies and clinical microbiologists, all of those basically. Again, I will talk about these things. It's critically important to have two-way interchanges, summer internships, traveling museums, workshops, a very robust, nice pathology day. Let's celebrate who we are. Low-cost scholarships. I'm not talking of NIH summer scholarships. I'm talking of small, you're building up a huge digital pathology setup. Why should students be part of that as it matures, working with digital microscopes, working with the AIs and all of that, so we can look dynamic. But there are unique challenges in every community. In Seattle, for example, I've got a pulse on my own community. I talk to a lot of students, and a lot of them these are very smart kids. They want to go into computer sciences. Their parents, their uncles, and their aunts are working with startups and stuff. And if they become successful, they sell their companies, make tons of money. So that's the challenge of recruiting our own kids into pathology or into medical sciences from the Seattle area, because of the strong presence of software and computer technology fields. What about medical students? What should we do there? Or before, excuse me, what should we do in colleges? Again, pushing careers in biomedical sciences is important. And this should be done both at the local level as well as a well-coordinated national campaign. I will keep hitting the well-coordinated national campaign again, because any institution can only do so much. The local institution must share resources. It's not just an issue which is impacting University of Washington. It is affecting Kaiser. It is affecting all other hospital systems. And we should share human, financial, and technical resources to promote lab-based careers. Again, summer internships from colleges. Let them come in. They need to be close to us. They need to see what we do. They need to know what pathology is. And then a day in the laboratory is what I propose. It's not just a casual 1 hour exchange. By the way, I don't know much about what might already be going on at University of Washington. So if there are UMEDs out here, I would be more than happy to learn from them, happy to work with them in my capacity as a colleague. But this should be a robust day, basically. It should not just be a 1 hour exchange, but a planned, exhaustive day rotating through various sections of the lab, and a close follow-up of, for example, a dummy sample from an MI patient to in the ED to the lab, and how do the results get back to them, and how would the clinicians act on those results? I think they need to see those things. What about medical school? And I think it's critical to the pipeline these first 3 years, because I think based on my interaction with the students, I realized the decisions they will start making their decisions in the M2 and M3s, definitely by M3s. We've run into many challenges with the integrated curriculum and the flipped classroom teaching. I'm not sure I'm very fond of flipped classroom teaching because although they would learn, they would teach, but we have become facilitators. And I think our input as teachers, as mentors, has decreased as I think, and others may disagree with me on that thing. Our classroom teaching needs to be enhanced. We must be aggressively introducing pathology as a career, not just through our pathology interest group, but in our classroom teaching. It has to be done. And we should be using our current trainees more robustly. Those are the ones they will more often associated with. Those are the TikTok guys, basically, rather than us. And then there's a great importance to winning, giving a department giving importance to golden apple and teaching awards. I personally think there's this time that we should invest in the National Pathology Teaching Academy. We need to be, there should be consistency in how we're teaching our medical students, and both inside the class and outside the class, online, through the cloud, wherever. And this should impact all academic pathologists. This will make us better teachers, and I think the time has come to do that. Now, about introducing pathology to future pathologists, again, continuing with the med school, about pathology interest group, and this is kind of, it should be, and I will go over some of these a little bit more detail. It should not just be food, but it should be, and the food will be the main attraction. Food always is, but it should go beyond that. There should be discussion on innovations, research, next-gen sequencing, digital pathology, AI, jobs, lifestyle. I just showed you something that indicated that even our lifestyle is kind of in jeopardy right now. And then how we involve, I mean, I do a ton of community service. For example, I've been feeding, with friends, we've been feeding people in Seattle for the last almost 15 months now. With working with restaurants and all of that, we've fed almost 30,000 meals basically. Working with the restaurants, working with the communities, invested and spent around $40,000 helping the community, working with 2 youth shelters in 2 tent cities. I think this is the kind of thing they need to see, that we were not isolated from the community. I mean, this whole COVID-19 pandemic, I mean, without pathology, imagine where the rest of the community would be. How are we going to sell this to our, the future communities, the potential pathologists for tomorrow? Then lab week, we just had a lab week recently. I'm not sure we invited students to the lab week to join our festivities, to give them a sense that we are happy people. We collected meals for the Northwest Harvest, basically, or we have our quotas to support all of that. But the students know, we are well hidden, the students know nothing about that. Then triaging, I will keep repeating this, triaging resident passion and leadership to engage future residents is critically important. They need to be appraised. They need to be seen. They need to have that experience to teach. They will stumble, of course they will stumble, but we will produce better teachers by putting them up front. I will talk about post-sophomore fellowship and challenges a little bit also. I think the program director's interaction with potential future residents is critical, really critical. I will talk about the counteracting the student doctor network factor, and that's a huge, again, a huge factor. And then the social media blitz and concerted positive messages. We should not be shy or humble. We should be aggressive about opening the world of pathology to all the forums, including TikToks, including every possible forums possible. Let's talk about a few things about pathology interest group and honor roll, for example. There is no uniform model nationally. Very few, if any, presentations or discussion at national meetings. I mean, this is a pipeline that is not much happening there. Virtually no published literature, and these are the pathology interest group are struggling in many of the schools, in many of the programs, basically. We need to know that. ICPE, or Society Council of Pathology Information, has done a wonderful job by providing small amount of funds and supporting material for pathology interest group. And I recognize them. Used to work very closely with them. Actually, they were the ones who helped me start pathology interest group at the University of Tennessee. Organizations like Association of Pathology Chairs do recognize gifted teachers. They awards at every institution, but they do not aggressively pursue recruitment of US medical seniors at the national level. You consider that a criticism, so be it, it is a criticism. The leadership needs to show that direction, needs to be passionately involved with that thing. It's all of us who should be. In all the departments, including University of Washington, promotes publication grants, revenue dollars, as they should, but they should be more of exposure and more support of medical student recruitment and recognition of those who help recruit these students to pathology. And this is just an overview. You can see the slide group here for University of Washington. A little bit of ad about ICPE and what they've been doing, and they have done a very nice job in as much. But they need to change. If you look at their presentation, these are not dynamic. These are not compared to what's available out for other fields. And I think we should be much more dynamic, much more interactive type presentation, starting from high school going up. What about post-sophomore fellowship? Now, this is a very nice option for those who don't know about it much, is to introduce pathology to MS2 through 4. And this would allow student loan deferment, medical insurance through medical school still available to them. They get a healthy stipend and perks, including purchase for learning material, traveling, and all of that. But the recruitment rate into pathology is still 50%. So 1 out of 2 who would spend 1 year with pathology would still not come to pathology. Is that a failure? I'll let you all decide about that. And this is from an ad from the University of Washington. And there was a very nice paper in 2019 about post-sophomore fellowship. And I will go over a little bit of a challenge, where this challenge is coming from. And this is the main question that impacts post-sophomore fellowship. I'm not very up to date. I was going to talk to some of my program director colleagues, but I didn't get a chance to do that. But I don't think it's changed much, if any. The big question is the post-sophomore fellow a trainee or a student? ACA-GME, which is an oversight body for residency, says, no, it's a student. And we have pushed American Board of Pathology extensively to accept this 1 year as in lieu of residency. And my belief is that number would substantially shift from 50%, more like 75%, 80, 90%. But the two organizations cannot talk to each other to allow us this thing. And this is something we need to actively pursue. Because a student who spends 1 year can still get benefits from LCME, but still be part of a training sector. They get the same training, the same oversight, absolutely the same thing. And I've worked with the post-sophomore fellows here from the University of Washington. They are comparable to some of the residents I've worked in my previous residency program. They've been equally good, very responsive, outstanding trainees, basically. Except that the ACGME would not give them that credit, basically. And I think we should be the APC should keep pushing this issue until it's resolved in our favor. Especially telling them that we at NCME and others that we have a huge challenge recruiting our own medical students into pathology. Let me share some of the comments from the student doctor network. Now, this is not all bad, by the way. They have a substantial impact on the US medical seniors. There's a wealth of discussion, camaraderie. They talk to each other, help each other. I've followed them for the last, since I've become a residency program director, I've followed them very closely. Don't speak, don't say anything. But they support me. There's a lot of information. I can see trends. They will talk about other programs, poo-poo them, let them know better, whatnot. But it's a very good group for each other. But these are the comments that you will see about pathology. These are recent comments. These are not old comments. And I will read them to you. One comment number 1, overall, I'm very pleased to see a record low number of USMD seniors applying into pathology. These are our own medical, either students or recent graduates who are working somewhere doing something else. Second question, do a lot of IMGs in these programs stay in the US to work or go back to their respective countries? Do they make getting a job harder in any desirable places? In the third comment, look at this. When a specialty like pathology is commoditized, As it has been, then raw supply and demand numbers really matter. Pathology could really learn from the forward-thinking leaders in the field of dermatology. These are real comments from student Dr. Mehta. So talking about the demand and supply, our residency slots have increased. Our, our own seniors applying have decreased. Our seniors matching into pathology have decreased. The numbers I've shared already. And there's something very interesting that I've been thinking about and looking at. There's no data available, but I think this is real. The IMGs who are non-US citizens, if they want to stay back in this country, then they're typically either on J1 or H1, mostly J1, a few H1s. But in order for them to convert the J1 visa to a working visa, they have to find sponsorship jobs. And that creates unique challenges for them and also gives the programs, academic programs, an opportunity, a constant supply line, basically. So they will work in the academic center for 2 or 3 years, get their visas swapped, and then go back work in the private community and other places, basically. And in that, they create an sometime oversupply of pathologists in the field, which allows academic programs to hire them at a lower rate, basically, than they would have done otherwise. And I'm going to go over that a little. So for those who don't know where the monies come for, trainees typically come from Medicare. VA is also the number two big sponsor. Some states use Medicaid money. And apparently a very small number of privately funded slots. I'm not familiar with them, but they're there. This is important for the number two, but there are significant benefits for the hospital systems too, for both quality and cost saving. And I'm using the word cost saving because that is what it is. For hospitals to support residency programs, if they slash the residency slots to make pathology more attractive, they would have to hire mid-level providers and physician extenders at their own cost, basically, and then that would undercut their profit margin as well. So it's not just a cost issue, but it's a quality and cost issue, basically. And I may be wrong. Feel free to correct me down the line. And so every year, a significant number of pathology trainees are out. And this is a yearly process in the market looking for sponsorship jobs from academic institutions, and the supply keeps downward pressure on academic pathologist salaries. That's kind of is a fact, basically. Let's look at the starting salaries for pathology versus radiology. And these are academic numbers, but include these are the ranges are academic essentially. These are academics, and I'm not talking about private is higher. So the pathologist salary is 100, and the rest students know about it, 180,000 to 200,000, and then radiology starting salary is 300 to 350,000 dollars, academic. And then average salary for a pathologist is 280 to 300,000, and for radiologists is 450 to 500,000. And I know there's some pathologists, I have friends actually in private communities, small communities in private pathologists who make 500, $600,000 and more and all that, but that's a small number. And that there are pressures on our salaries and pathologist salaries across the country. So the pressures on demand and supply, constant reimbursement comes from Medicare and insurance companies. Pathologists are working longer hours, and this is important, and they're retiring later. I don't think this will impact the life balance sought by the newer pathologists and medical students. So the newer pathologists or the medical students don't want to come to a field, where there would not be work-life balance, or they have to work for longer hours to make the cutting salaries that they will be making. There's virtually very little data on need-based numbers for fellowship and fellowship-trained pathologists. So we start a fellowship because it helps us with the service, it helps produce them, but is there capacity for them to be absorbed? What is the impact on the market? No one knows. We don't have those numbers. What about the change practice trends? And I'll give you an example, my own example. When I was a resident, for example, in my residency, I'd done 80 bone marrows myself. When I became a fellow, I didn't have to do a single one. But as a resident, I did 80 plus bone marrows. I would go talk to clinicians, talk to nurses, talk to patients. And then over time, what's happened is dermatologists are now doing dermatopathology. The bone marrow biopsies have been taken over by the nurse practitioners, physician extenders. The FNAs are being done by the ENT and radiologists. And the pathologists, and so these are places where we had exposure to patients and other clinical fields. Now we are back into our offices because we can make more money churning out slides essentially. Because it takes time to go and to do a role or be part of a role actually. And then it's not just that, but we were not able to stem the GI and urology groups hiring pathologists, not only keeping the technical component, but also a part of the professional component. I'm not sure that's the right thing they should have done, but and I'm not sure what happened. I don't want to get into politics there, but these are real things. And then there are high throughput companies like LabCorp, Quest, others, and then there are mergers, huge big mergers now going on, consolidation. And LabCorp is now, I know for sure, I mean, in Tennessee, for example, they had a contract for the academic hospital system. They were doing most of the a lot of CT tests and consults and all of that. And that's a national thing going on. And this is from the Dart report. And we're talking of disruptive trends now. And this almost came to fruition. And there were proposed Medicare cuts for our professional fee schedule for fees by 9%. This is from in 2021. Somehow the legislators got involved, or bodies, the professional bodies got involved. But I bet where it's going to go. I'll tell you what, we may not be hit by a 9% cut, but it could be like a 3 or 4 or 5%. We'll have to accept that. And this money was supposed to be redistributed towards primary care, essentially. What about other disruptive trends? See, everything has a flip side, right? We are so excited about bringing in digital pathology, right? I mean, you can see it here, digital pathology. Let's start with HPV vaccine. It has a high penetration in Australia, and thank God for the vaccine naysayers in this country. They would not allow our kids to be vaccinated. So the cervical dysplasias and disease and cancers persist, head and neck cancers persist, anal cancers persist, and all of that. But once that vaccine kicks in really big time, how do you think it will impact our practice? I think these are important things we need to talk about. We need to have these think tanks understanding where it's going. Now, next sequencing is a big thing because if you look at the two big trends that are going on in the field, not just in medicine, one is digital wallets, basically, the really big thing, how the money will be transferred. And the second thing is next in sequencing, DNA. DNA is big, huge, well beyond medicine. And how much leverage do we have as pathologists on next-gen sequencing? I don't know. Digital pathology is outstanding, great. We will be doing a lot of good work with that. But once you digitize images, you can transport those images anywhere in the world. And then AI will have a substantial impact on how we practice pathology, in interaction with the hospital information system, including digital pathology. We are getting our own augmented reality microscope in less than 2 weeks, basically. It's a collaborative project between Department of Defense and Google, and there are two VAs which will be testing it. We will be one, and the other one is Palo Alto. And somebody was teasing me, saying, "So are you trying to, kind of undermine your own job?" And the answer is potentially down the line, yes. These are trends, these are disruptions, these will impact us, and the students know about these. So the question is, are we doomed? And I don't recommend we take the Charlie Brown approach to this. Now, this is easier said than done. This slide is important. And there are two ways of looking at it. So the total US senior match applicants are 18,435. Those coming to pathology is 198 or 1%. But the question is, can we increase this number from 1 to 1.5% by 2026 or 2030 or 2032 or 2033? It's a small number, 0.5%, but actually it's 50% increase from what we are at this point in time. But unless we set ourselves ambitious targets, we will continue with the slide because the momentum is against us. So should we accept the current status as fait accompli, or do we want to change the status? Fundamental question. Can we do that without being data rich and granular? Know the current needs, what are your needs, our needs, national needs, where would our fellows find well-paying jobs? We should accept and try to change the fact that we are a very fragmented community, geographic, academic, private, state, region, working type, anatomic pathology fields, clinical pathology fields, then organizational, multiple organizations, some overlapping, some not, some competitive, and then classify job placement where, why just the word of mouth? I mean, if we don't advertise, we don't open those positions, how would the student know that the jobs are out there? And then the social media presence is critical. It is primitive at best right now, and we need to connect there basically. So what about academic institution and organizational nexus? So how should our academic institution and professional organizations work in sync? We cannot be out in silos and not work with these organizations basically. So CAP and other ASCP, Melissa, I hope Melissa is here and all, but that we need to work closely. It is a common challenge, it is a common problem. If I can use the term, it's a common failure. And we have been separated long enough. We need to develop cloud-based pathology museums to benefit high school and college outreach efforts. We are not just dealing with dead bodies, for God's sake. We need more funding for summer internships, spending a day with your pathologist, be visible. They go spend time with the clinicians, GYNs and all of that. Why can't they come to pathologists? They have no idea who we are. What is a pathologist as opposed to who is a pathologist? And then much more, this is in support of my community from UMED and PROS. I think every program, this is a struggle that we have always had in every program essentially. We need much more exposure to our UMEDs and PRODs through all the professional organizations. We need more financial support for this community. They should be nationally robust and enriched educational material developed. So when we go and talk to the students, we should have tested material available. And so an entire community, because we might get students from University of Washington, we might get them from University of West Virginia, for example. We should be invested in their education and to the highest possible and the most sophisticated needs. There should be multiple teaching and technology awards, basically. There should be more podium and poster presentation and national meetings, more invited and peer-reviewed articles in pathology and education journals. That's a room which is open, available. And then grant support increasing over time, not just a small bed, but keep increasing this over time. There needs to be more robust funding and support for the pathology interest group and student honor roll. And there should be a senior push towards post-sophomore fellowship in lieu of 1 year of residency by the ACGMA. Critically important thing. As for the chairs, they must be more enthusiastically seen supporting this effort, every effort, and well beyond the current status. They must attend at least one session of the pathology interest group every year. The more, the better. The more they interact with the students, the more likely we will get those students to come to us. For promotion and tenure, there must be a higher appreciation of humans and program directors. It's not there. I mean, I ran into struggle. I had always ran into struggle trying to tell my research colleague what I'm doing basically, and why my job was critically important at the University of Tennessee. It was a fact. And then this last point is critically important. Even if they don't come to pathology, in every class of medical students are future leaders of medicines, deans, and they will, and chiefs of staff and presidents of practice group, and they will decide the future of pathologists as well. So I think it is important they get a very good sense of who we are, and they should have a ton of respect because that's our investment in our own future. In the last couple of slides, so can we leverage the future of pathology well beyond our working life? So if somebody says, so if somebody asks you if digital pathology going to impact your jobs, please don't say that not in my lifetime if you have 5 years of retirement. Because the residents, for example, who are sitting with us are looking at a 25, 30-year scale, basically. Our answers should be scaled to where life is moving to. We should be mindful of what disruptions will enrich pathology, make it more automatic, algorithmic. So what is the impact of digital pathology on the manpower we need? What if AI comes in there as well and start making things more organized? Well, so what about the payer models? Would the insurance companies continue to pay, say, oh, we don't need to pay for this, the AI is sophisticated enough? How many pathologists do we need in 2025, 2030, 2035? We don't know that. We have some projected numbers, but we not with those disruptive trends in place. We don't know that. How would DPAI impact pathology? If hospital administrators right now can't see value proposition for digital pathology, why would Medicare and VA see that value proposition? What are the challenges facing our business model? All of these are challenges which are facing with our business. And what about the cuts in our professional fee schedules? And would we make the fatal assumption that our students would not know about any of this? That would be a really fatalistic assumption. The last slide, and that's summing it up. And pathology is an aging field. The leaders, unfortunately, have had little exposure to social media. We had to struggle to get them on Twitter and other media, basically. Very little idea about digital pathology, AI, next-gen sequence, CRISPR, for example. In connecting our threads, so it's important to connect our present with our future to engage our medical students. They are pathologists of the future. We must connect them. There needs to be very nice connection going forward. Our visibility definitely needs to improve through the undergraduate medical curriculum. Our students should know that we are neither recluses nor weird and have a very good work-life balance. They need to know that. And we have to be in the middle with them or to get them to us for them to know these things. We must impart significant leadership and business management training at every level, not just to our trainees, but to our pathologists, junior pathologists going up. We must practice lean pathologies to conserve resources, to be more profitable. Otherwise, we keep hurting our financial well-being. And our professional organizations need to work together better, as this is the collective failure to engage US medical students. And I'm going to stop out here, and I have 10 minutes for question and answer. And I thank you for your patience on this.
Thank you, Nadeem. These are questions a lot of us have thought about through the years, and there are no easy answers. So actually, I put a couple of questions in the chat, and hoping that they might stimulate some additional questions. As Nadeem said, he would like this to be quite open, quite a discussion. But one of my questions is, I've heard that there will be an increased demand for pathologists in the near future. Is that correct?
So we have been hearing about this for a long time, that there will be an increased demand. But Larry, we don't really know what kind of pathologists, what areas, how many, what kind of a supply chain we need, what kind of, we don't have any of that. Needs to be a very granular bit of information. The question is, if you think that there will be an increased demand going forward, the question is, why are the salaries not matching that?
Yeah.
So there are a lot of factors. Yes, there will be an increased demand, but it is not necessarily just because of the growth, but because of might not be producing enough of them, or we might not be paying enough, or we might not be strategically placing them across the country.
Yeah. Nadeem, the second question is really sort of a marketing question, and that is, given the large number of IMGs applying for pathology residency, as you said, more than any other subspecialty, what would be the effect of decreasing nationally the number of pathology residency positions, and decreasing it in a thoughtful manner, where those positions that are available can be made to be more high quality, or at least perceived to be more high quality than general ones? And that I realize becomes very difficult to phrase. But what do you think the effect of that would be?
I think that's a very logical question, and I think you phrased it. It's a delicate question to ask, and you phrased it well. And I'm an MD myself, so I think there will be a supply chain which will be available, and one of the points I addressed, basically, if you look at the hospitals get both quality and cost benefits by bringing in and, by monies coming to, in essence, the taxpayer is also funding and supporting the hospital function, which we will otherwise have to do by providing mid-level providers, physician extenders, and all of that. So even if you cut, even if the point is not to cut the residency, if you want to increase salaries, you have to increase the salaries and reimbursement for. It's a fact of life. It's not just the sensitive thing to bring this up about IMGs. It's also a sensitive statement to make. But it's a true statement that the more money wherever it is, our students will go there. I think that's true. That's something that's kind of been discussed. It's typically we will write about it. So what's going to happen is there is a supply available there. Radiology has been able to maintain a very good balance between that. And we need to look at that model and figure out what is it that makes them attractive and what makes us attractive. So and I think one of the major factors there is monies basically coming in, and that's so you will always have supplies available because the hospital needs residencies and residents in there to be extenders of consultants and attendings and to take care of their day-to-day function.
Yeah. I see that Libby Parker raised your hand. I think you have a question, Libby. And actually, I was going to ask you, what's your impression given all of your experience with the medical students now?
Yeah, thanks so much. I just love hearing about these kinds of concepts and topics at this in this forum. So thank you so much for sharing. I'll start with my question. You mentioned this really, what I think is a really important concept, which is that pathologists are inherently educators. And we are traditionally educating, of course, our treating clinicians, indirectly perhaps patients, and then also students, residents, et cetera. So I think we are all educators was sort of a thesis statement that I heard you make, which I really agree with. And so my question is, how can we better teach our trainees, these future educators to be educators? I think it's kind of maybe a little meta, but essentially we're in a role where we are educating educators. And I wonder if your thoughts are that, we just maintain the status quo, which is more of an apprentice style model where we model the behavior and then trainees step into tumor boards and practice, or if there is room and a need for more formal curriculum, didactic series where we really highlight educational concepts. So that's my question for right now.
I think that's a great question, and I thank you for asking it. So there are multiple things that we can do. When I was in Tennessee, for example, we had small groups, and these small groups were run by our residents, basically. We would provide them with all the support they needed, and we were training them. My residents were also teaching cytotechnology students and lab tech students, basically. So the residents were getting a lot of that training to be good educators. So that's that aspect. I think we should never forget that the medical students and even high school students will connect better with these younger pathologists because that's a natural tendency for humans to do. It's a bonding thing. That should, and then we are investing in the future as well. There are two other things that I touched on basically. One of the things is we are educators, but the education now, if you look at education being done in other fields, computer sciences and other, they are much, much more sophisticated. And I think that needs to be multimedia and all of that kind of thing. We have huge bandwidth in Seattle area, for example. We should aim for to be some of the best teachers in the country in pathology. I think some of you already are basically. And so, and the other thing I talked about is a teaching academy. Basically. I think that's a critical thing to have at a national level where we all come together, contribute our ideas. It actually adds value to what you are doing, what I'm doing if I'm a graduate from that academy, because then we set a worldwide trend of how America is doing it. And so we are not all natural educators. We are not. Some of us are better than the others, but those kind of ideas, those academies will make a difference. But putting residents up front, triaging their passion, because they've already made that decision to come to us in the face of all that odds that was stacked up against them. And I think we should keep pushing them to make them better ambassadors of who we are. And I thank you for asking that question. And I think I would strongly support that. Hope this answers your question.
Yeah, thank you so much. I do have a follow-up question, but I don't know if somebody else wants to jump in.
Take it away, Libby.
Thanks. So just to follow up, you touched on social media, which I think is a very fascinating and sort of, there's actually quite a bit of literature about the power of social media, specifically relating to pathology, and just sort of this untapped potential to really educate the wider community outside of medicine, but also potentially our future colleagues, future pathology trainees. And so I'm just curious to hear your thoughts a little bit more on social media, sort of, I don't know if you have lessons or words of wisdom other than just promoting social media use. I think it's a challenging landscape, I think, with PHI, and I'm just curious to hear you expand a little bit more on your thoughts on social media within pathology education.
Can I just, hey Nadeem, can I just add to Libby's comment? And that is that, I've also been very interested in social media, but then I've been pretty reluctant to do it, just wanting to maintain privacy, not sharing what is unleashed once you hop onto social media. And that may well be a feeling that is shared amongst people.
So this is these are both very interesting questions. And I think that's one of the topics. I think at some point I will need to address that too, because that's a $1 billion question there. We have published this year on social media and pathology, actually, and in this manuscript has just come out, and we kind of did that through Association of Pathology Chairs meeting through 2018 and 2019 or 19 and 20, and kind of we monitored our numbers and we used Twitters and all of that kind of thing. But we have been pushing this for a while. I've been one of those people who've been involved with this thing and pushing, because I'm a social media buff myself. So I think it is critically important. And this was, social media is not just about professional presentation. They can be, and then you can use it for teaching. And I think a lot of people are using it for teaching. There have been presentations through Facebook. There have been presentations through Twitter feeds. And I think we need to have smaller, even now, presentations through TikTok, talking about specific topic, not necessarily about specific presentation and all of that. So that's the professional part. The second part is, I think one of the things I touched upon is, for example, if somebody's coming to University of Washington and he's going to be interviewing with Elizabeth Parker, MD, for example, if I was him, I would tell him to go check out on your social media presence, or Lawrence True's social media presence. And if you go to my social media presence, you'll see recipes, what I cook, you will see photos of my pets, you will see good music that I share. I'm a human being, for God's sake, and I'm not just so there are different types of social media. Socially responsible, homelessness in Seattle, feeding people in Seattle. All of those things you will find on my social media feed. Now, when you talk about specific patient-related things, there have been some issues actually in some of the other institutions where residents, put up stuff that they should not, and they were kind of, not following the policies. We need to teach our residents. We need to teach. This is all about learning, basically, on how to, use social media responsibly. But it's not just professional. It's about putting a human face to who we are. Maintaining, there are songs out there. You can get songs about pathology, and residents enjoying themselves, singing and having a good time, having a party, and all of that. So I think those are kind of all these different issues. But when you come to professionalism and you're talking about patients and all, we have to be careful. But we have to learn and we have to teach them as well.
Let me also actually take the opportunity to solicit comments from one of the other attendees. And I see Charlie Alperts is on. Charlie, would you mind making a couple of comments or sharing your thoughts?
Sorry, Larry. I was just called away to do a clinical, to respond to a clinician. I didn't hear the questions.
No, I was just wondering if you had any thoughts you'd like to share with us about how to recruit more to pathology, and how that's basically the bottom line.
Well, I give Nadeem a lot of credit for touching on almost all of the issues that I can think of. I don't have new issues to introduce. I'm probably like many people. I think that there's much that can be done, but there isn't always the resources or or availability of time and effort to do it. I appreciate efforts that even in our own department, though, that have been done by Libby and before her by Mara Rendy, to really engage medical students, which was a big theme of Nadeem's presentation, which they've been successful in. The numbers of people that come out of it, if you look at it compared to the overall numbers of medical student applicants to pathology programs nationally and the number of medical schools, I give a lot of credit to Libby, to Mara, and to others working with them to produce quite a good number of graduates from our own program to go into pathology, showing that these kinds of efforts do work.
Yeah, thanks, Charlie. One of the take-home messages I have is just learning more about how to get on social media, and I guess here the detail, which is important, is how to make one's social media presence informative and stimulating. And Nadeem, maybe given your experience with that, maybe you can provide us some guidelines.
I'll be happy to kind of work with Libby and all of you. And I think it's kind of, I think people, if anyone's coming to you in your department or our department, they want to know who, Larry True is, for example. Larry True is not just a, very smart pathologist, well-respected pathologist, but he has other passions. He may want to trek the world. He may want to eat good food and all of that. And that helps us bond with people. One of the questions I would typically ask the candidates who would come to interview with me in Tennessee is, if you did go into medicine, what are the field you would choose? And say they would turn around and ask me the same question. I said, I would be a chef. I love to cook. So I think those are kind of all those things, you be who you are basically, and then people will love you for that. And that's what social media is for. But teaching our residents what not to put and make sure that, those PHIs and all of that, we can easily do that. And I think that should be part of our culture as we are teaching them, training them. Also for medical students, by the way, our medical students, for example, should learn the art of setting up, for example, setting up, startups, for example. Why shouldn't they know that if they're if they're graduating for Seattle, they don't know how to set up a startup, for example, in whatever they're doing. I mean, these are kind of things we should take advantage of the local environment, work and be good at and be different from the rest of the country by taking advantage of who we are, where we are placed.
So thank you, Nadeem. And our hour is up. The one other thing I wonder is whether we might even arrange for Mara Rendy, who was so successful as the teacher of medical students here, to even give us a presentation and let us learn from her just how she was successful, to the extent that she was, I think it was 2 years in a row, was nominated as the speaker of the medical students graduation ceremony.
I would love to hear that. It's lifelong learners always love to hear from people who have been successful.
Okay. Well, thanks again, Nadeem. A very, very thoughtful and deep presentation. I look forward to follow up and continuation.
Thank you so much, you all. Thank you for being here.
Thanks again.